Hello guys and welcome back to my channel. This is your family doctor. First of all, I would like to thank you all, especially all my patients, for your amazing response on my very first video on YouTube, which was on fever in pediatric cases. Many of you all had requested me after my first video to discuss what we shall be discussing in today's video. Again, a very common ailment in children below the age of 5 years, सर्दी खांसी और बुखार. लाइक फीवर, सर्दी खांसी भी एक बहुत ही कॉमन एलिमेंट है जो 5 साल से कम उम्र के बच्चों में पाया जाता है. Maximum cases are due to some kind of viral or bacterial infections. Sometimes the cough can be because of allergic reactions as well. Most of the cases of cold, cough and fever are mild and are usually taken care of in 4 to 5 days. माइल्ड फॉर्म में बच्चों को पहले 3 से 4 दिन बुखार के साथ सर्दी और उसके बाद खांसी होती है. द फीवर यूजुअली सबसाइड्स बाय द 4th और द 5th डे. खांसी भी यूजुअली 4 से 5 दिन के अंदर अंदर ठीक हो जाती है विद द रूटीन मेडिकेशंस. समटाइम्स खांसी जाने में समय लग सकता है, स्पेशली इफ इट इज़ अ ड्राई कॉफ. ड्राई कॉफ समटाइम्स कैन टेक अप टू 15 to 20 days टू सबसाइड, बट यूजुअली वो खांसी से ज़्यादा चिंता करने की ज़रूरत नहीं होती, स्पेशली इफ देयर इज़ नो फीवर विद द कॉफ. अगर खांसी के साथ बुखार नहीं है बच्चे को, तो इवन इफ द कॉफ इज देयर अप टू 15 days, देयर इज नथिंग टू वरी अबाउट, बिकॉज मोस्टली वो खांसी एलर्जी की वजह से होती है और एलर्जी की खांसी को जाने में थोड़ा समय लग सकता है. एज आई सेड अर्लियर दैट मैक्सिमम केसेज ऑफ कोल्ड, कॉफ एंड फीवर आर यूजुअली माइल्ड एंड दे यूजुअली सबसाइड इन 4 to 5 days, but few cases go from the mild to the serious form. In today's video, we will be discussing those signs and symptoms which help you to differentiate between the mild case of cold and cough from the serious cases of cold and cough. So let's get started. अगर मेडिसिन देने के चौथे 5वें दिन के बाद भी आपके बच्चे की खांसी कम नहीं होती, एंड इवन मोर इम्पॉर्टेंटली इफ द फीवर इज नॉट सबसाइडिंग, then it means that the infection might be serious. This usually happens when the infection is strong and it is not responding to the routine line of medicines. Mothers are usually very quick at detecting this sign because they are very well aware of their child's normal breathing pattern. बच्चे की रेस्पिरेटरी रेट देखने के लिए आपको बच्चे के पेट को देखना होता है. इफ़ यू सी दैट द abdominal मूवमेंट ऑफ योर चाइल्ड इज़ वेरी फास्ट, जो नॉर्मली पहले ऐसे नहीं हुआ करता था, I will show you how the respiratory rate can increase. You have to look at the abdomen. अगर आप देखते हैं कि आपके बच्चे के पेट का मूवमेंट इतना फास्ट हो रहा है जिसे नॉर्मली कई लोग पेट को उड़ना भी कहते हैं, then it is not a good sign. In such cases you have to inform your treating physician immediately. An increasing respiratory rate with a decreasing oxygen level और oxygen saturation जिसे हम कहते हैं, जो कि नॉर्मली अभी कोविड के टाइम पे हम सबको पता है, वो पल्स ऑक्सीमीटर से जो चेक करते हैं. If these two are there simultaneously, it means that the child is having a serious lung infection and it requires urgent medical attention. Any cough which is usually associated with difficulty in breathing is not a mild form of cough. In such cases, parents have to be very careful. A child is never going to come and tell you that I am breathless or I am having difficulty in breathing, या मुझे सांस लेने में दिक्कत हो रही है. But there are very clear signs which parents can easily catch to know whether your child is breathless or not. If your breastfeeding child is not able to suck the milk while feeding, or children below 2 years of age are not able to eat and drink without taking a pause, or they are not able to speak a complete sentence without taking a pause, or they are usually not playing, or they are not able to play, they are getting tired very easily, or when you make the child lie down, the child is not comfortable, the child starts coughing aggressively, he is just not comfortable, there is a lot of discomfort, बेचैनी जिसे हम कहते हैं कि बच्चा बहुत बेचैन हो जाता है जब बच्चे को सुलाते हैं. Or if the cough is keeping your child awake at night, he is very much in discomfort, very much uncomfortable, especially in the night. The child is not able to sleep because of the cough. These are a few signs of breathlessness in your child which you need to keep a note of. They are important and they can indicate that the child's infection is not mild or the cough is not mild and you need to take proper medical attention for it. Normally a child's lips and nails are pink in color, they are bright and shiny, the face is glowing. If you see that your child's nails and lips are turning blue or the face is becoming dull, which was not there previously before the child is having fever and cough, it is not a good sign. Blue discoloration of nails and lips is a sign of cyanosis, which is improper oxygenation of blood. अगर मैं सिंपल लैंग्वेज में कहूँ तो बच्चे के खून में ऑक्सीजन की कमी हो रही है, which usually happens in cases of severe lung infections. Well, these are a few signs and symptoms which every parent must keep a note of, especially if their child is having cold, cough and fever. As a doctor, I always tell my patients, it is always better to take a step before something goes wrong rather than taking a step after things have worsened. That's all for today. I hope you liked this video. If you liked it, please hit the like button, share it with your family and friends, and please don't forget to subscribe to my channel. That's your family doctor saying goodbye and thank you.